Let's take a look at some of the research about breast cancer. In the last 2 years, it appears that 66% of women 50 years and older in the United States have received a mammogram. But did you know that only 23% of Southwestern Native American women 50 years and older in the U.S. have received a mammogram? As a result, breast cancer, if it is found, it's going to be found in the later stages. The later stage breast cancer is detected, the more difficult it is to get a cure, and there are lower survival rates. Now here it says that getting mammograms early can increase 5-year survival rates up to 98% among women with breast cancer. That means that breast cancer screening is done early, whether it's in the form of a clinical breast exam done by a healthcare provider or through a mammogram. Breast cancer, if it is there, will be found earlier, leading to higher survival rates. It's important.
I don't think they prioritize breast health. I think a lot of women are afraid to find out if they do have cancer, or they don't want to go in for the test. Myself, I keep up with my mammograms because I have breast cancer in my family. I have a sister that's a year older than me that had breast cancer and had both of them removed, and for that reason I try to keep up. I lost another sister to kidney cancer, and my dad had prostate cancer, so I try to keep up with my breast mammograms. No, I think they don't. I've been to some areas that are remote and I think don't have that. As far as I know, they'd have to come in either to Phoenix from reservations to get it done because some of the hospitals don't have it there. Oh, I like it. I got a t-shirt, a nice t-shirt, and I think that Native women need to keep up with their mammograms to find out, catch it early while you can, it can be helped, so you need to catch it early.
Some patients have asked me, what is breast cancer? Breast cancer is the abnormal growth of breast cells. They can occur to anyone, women or men. Some of the more common symptoms or signs of breast cancer are masses or lumps in the breast area. That includes under the arm. Also, there can be a change in the appearance of the breast. There can be dimpling of the skin, redness, unusual sensations in the breast, nipples that were normal in appearance before can appear to look different, inverted. There can also be abnormal breast discharge from the nipples. All of those symptoms mean that you need to be seen by a healthcare provider. It may not be cancer, but you won't know until you get it checked out.
My name is Betty. I'm from the Fort McDowell Nation.
Oh, wow.
Well, I don't know about this younger generation, but the previous generation, it's not only breast cancer, but any kind of disease, high blood pressure or TB, tuberculosis, all kinds of disease. They always say, oh, that person's got white man disease. The reason why they say that is because back in the days when Columbus came over, they said he brought all these diseases. And when we were in our 1600s, we were always out there in the mountains gathering. The women would be gathering berries and desert seeds for survival. Our men would be out there hunting. We had no time to have this disease, I guess, because we were too active. And after, when the government placed us on a reservation and It was like cooping cattle or horses in a corral. It was hard and stressful for us to get used to being on a reservation. The government left us there to die off from diseases, they said, from what I read. But the thing of it was, we flourished. Although it was difficult for us, that's when we start developing all the what they call the white man disease. Cancer, high blood pressure, tuberculosis, and all the other things, that diabetes and all these, is because in our days, maybe we ate the right thing, and we weren't overweight, we were all slim, and, we're always just very active people. The woman never, I believe there was never a chance when they had to sit around and kick back. Nowadays you call this, where you just lay around, watch television, and munch on potato chips or popcorn or something, candy bar. No, there was no such TV. We lived in what they call wickiups, brush houses, and there was no plumbing, no electricity. We had to look for what to have for survival, to eat that day and the next day. At the same time, we had to watch out for our enemies that were trying to invade our area, where we try to stabilize, but we never stayed one place. We're kind of nomadics, we're kind of wild, but I've known of different tribes that live out there and they did farming, and they were lowland, plain people where they gained weight and didn't do much exercise. But my tribe were very active people in the days of the 1600s, and even before then, And now this disease is got to us as we settled on reservations. It seemed that's why they call it white man disease.
Another important aspect of breast health is to know your risk factors, to get screened regularly, and to know what is normal for you and your body. Things that put us at a greater risk for developing breast cancer are genetics, having a first-degree relative with breast cancer, or being tested and finding that you have the breast cancer gene mutation, having a history of radiation between the ages of 10 and 30, or from early childhood into early adulthood, and you yourself having a personal history of ovarian cancer or a previous history of an abnormal lump. Women who are also members of certain ethnic groups are at higher risks for breast cancer as well. These women should be screened more frequently in regards to the guidelines. Normally, as we age, our breast tissue changes, and the most effective tool that we have for screening is a mammography. Mammogram is most effective as we age. 40 years old, the breast tissue starts to change and it's less dense. So as a result, that's where most of the guidelines indicate to begin screening at the age of 40. A clinical breast exam done by your doctor in a person with no history or risk factors can be done every 2 to 3 years, although personally I check my patients every year. It's also recommended that you do self-breast exams monthly, or ideally we would like for you to do it about 5 days after your period, because the hormones cause your tissues to change. But if you cannot remember to do it 5 days after your period, it's best that you just do it on a regular basis. The reason why we recommend that you do self-breast exams is because you know yourself more than a provider would be able to know you. you learn what is normal for you. If we were to ask, every woman will say that their breasts are a little lumpy. It's normal for the breast tissue to be lumpy. But what we're looking for is a nodule or a bump that is firmer than the normal lumpy tissue. That's more concerning, and that's what we want to detect. And self-breast exam provides you with a tool to know this isn't a normal state for me. So it's important that we do the self-breast exam. Self-breast exams is an important tool for us because it helps us identify benign conditions of the breast as well as concerning conditions. The way we recommend that you do it is to choose 3 fingers, and you're going to use the flat part of these fingers, and you systematically palpate the breast in a circular motion, or you may also go up and down across the breast. Now, if this was your chest and your arm was here, it's important that you remember to get the tail of the breast, which goes on up into your armpit. 1 in 4 breast lumps are found in that area of the breast itself. So it's important not to forget about it. So you palpate that area, and then you start in a motion, kind of pressing and moving around your hands in little circles. And the reason for this is if you do find a lump, then you can kind of feel, does it move with the tissue or does it stay firm? We're looking for anything that's different from your other breast. The architecture of your right breast should very closely mimic the architecture of the left breast. Should you find something in one of your breasts that's not mirrored in the other, then you may want to call your provider and have them do a breast exam. Or if you have a history of having a benign condition, then you may want to wait another month and re-examine it. And if it's still there, or now it's becoming painful, then you schedule an appointment for a clinical breast exam. So that was an example of how to do it, working up and down. If you do it in a circular motion, you would go around the edges of the breast, and should you find a nodule, then you're going to feel that area and kind of work and push. And don't be afraid to push, because then you're going to learn more about that. You just don't want to poke at it. You want to be able to describe it. Is it ropey? Some women will have a ridge of tissue at the base of the breast, and they will feel that, and it will kind of freak them out or cause them some alarm. But often that's just the style of bra that we wear, and you will notice a very similar architecture in the other breast. So you palpate. You're going to look at your breasts to see, is there any dimpling, any puckering. That is concerning as well and should be brought to the attention of your provider. You're going to look at their nipple and make sure that the nipple is the same as it's always been. You don't want the nipple to turn off and point in an opposite direction. You also give it a good squeeze and see if there's any discharge. And then after you do your exam, and the most effective time that I find for my patients to do it is when they're in the shower. When they get out of the shower, I recommend that they just look at their breasts in the mirror, and you're looking for differences in size or shape, dimpling. but also the way that they hang. And you know, every day you look at yourself, so you know what's normal for you and what's not. And kind of lean forward a little bit, and then stand with your arms up above your head. And this is moving the tissue in different directions and putting, so if there is a little stress, you will be able to detect that.
Yes, it definitely does, because I've seen what cancer can do, and I always go in for yearly, but I just learned that recently that we're supposed to be going in from 35 on. We're supposed to be getting a mammogram, not only getting an annual breast exam. And I also try to encourage my family to do the same, because if you detect it early enough, you can, get it not cured but treated. But if it goes too far, then you're not able to cure it.
Right. And what have you learned about men and breast cancer?
I recently learned that men in the United States, 450 of them die from breast cancer, and roughly 2,000 in the United States are detected with breast cancer. So it's really important that they also get checked.